Well, it's 11:30 Central, 12:30 Eastern. We're going to go ahead and get started. Welcome, everyone. Thank you so much for joining us. Happy holidays. Hope you're enjoying this wonderful Christmas season. We have an exciting topic that we want to share with you today, and I'm going to just start by letting Ms. Cassie introduce herself first.
Hey, hello, everybody. My name is Dr. Cassie Himmen. I am an audiologist with Atlantic Hearing. I've been with the group for 4 years now, and I also serve as our territory clinic leader, which is essentially a support person within our organization, helping the clinicians and helping build them up and continue to foster growth and productivity.
Great. Thank you, Cassie. And my name is Megan Lynch. I'm the HR director for the Acuity Hearing Network, and I'm excited to be with you today. We are going to be discussing employee check-ins, a topic that is right at the heart of building thriving teams and delivering exceptional care in our private practice settings. As professionals in the field of helping others hear and connect better with the world, we know how vital communication is. But how often do we take a moment to reflect on how well we're communicating within our own teams? Just like the tailored care that we provide to our patients, employee check-ins are an opportunity to meet people where they are, understand their needs, and support their growth. Today, we're going to explore employee check-ins and why they are important, how to conduct meaningful, productive check-ins, and effective check-in strategies that improve accountability. At our teams recently, we have just gone through employee check-ins here at the end of the year, so very relevant topic amongst our group. And I know Dr. Cassie has some very relevant information to share with you. We're going to do this webinar kind of as a podcast style where I will be hosting and asking Dr. Cassie questions, and then she's going to be giving us some helpful tips and tricks. At the end, we will hopefully have time for questions. And if so, please, jot down your questions as we're talking and put them in the chat box. Sarah will be kind of our moderator here and be able to read those questions out here at the end if time allows. So thank you again for joining, and we'll go ahead and get started. So the first thing we want to talk about, and Cassie, I'm going to just go ahead and get started here. So why are check-ins important? If you could just share a little bit with the group.
Yeah, so in general, check-ins are important because we want to foster and build trust within the employees in the organization. We want to let them know that we are listening, that we care about their experiences in both life that they're living, as well as what they're doing in their day-to-day work life. So we want to make sure that we can build trust with them, let them know that we're listening. We want to be able to have feedback provided to us by both the employees, and then also open up an opportunity for us to give feedback to the employees as well. So feedback is important from both ends of the spectrum. The check-ins are also meant to help foster and continue the growth of the clinicians. We're always aiming to achieve better results, be better individuals, and serve our patients better. So what can we do to continue to improve ourselves? And overall, this is going to allow our clinicians, our front office staff, our managers to grow and also allow us to have a really great level of engagement with the individuals that we get to work with on a day-to-day basis.
Great. Yeah, thank you. Common question that comes up is, can you tell me a little bit about how check-ins and annual performance reviews are different?
Yeah, absolutely. So employee check-ins, they are something that happens more frequently. They're going to be a little bit more casual too, versus a performance review. Performance reviews are typically something that are going to be more formal, more structured, something that we may conduct on a annual basis instead of, checking in with the clinicians on a monthly, a quarterly, biannual basis for the check-ins. When we look at those check-ins, we're focusing on what we're doing moving forward, the actions that we're going to take to continue to improve. what goals the clinicians may have for themselves or the PCCs, looking at immediate challenges that they may be facing right there in that moment, as well as just checking in and seeing how the employee themselves are doing. Everybody has a different journey, a different story. Life hands us different things, and everybody is going to be going in a different track in life, and we want to make sure that we can engage with them and support them the best that we can. When it comes to those performance reviews, those are going to be more formal. They're going to be structured. We're going to be looking backwards more so. How have you been doing within the past year? What kind of achievements have you made within that past year? And then also, what areas do you want to try to improve on as you move forward? Like I had said about the check-ins, they're going to be more informal, conversational, real-time things that we're addressing. And we want to make sure that we can find ways to support in those conversations our teammates. What can we do as your leader or your support team in order to continue fostering your personal growth? A little difference with the check-ins as well. Like I said, informal. We often will sit down for a meal with the employee. We have a long coffee with them, taking our time, not rushing, really just staying fully engaged and in that moment with the employee.
Okay, great. And so building on that, what would you say are some key elements that a productive check-in conversation would include?
Yeah, so a productive check-in conversation, first looking at, sorry, my screen's a little, there we go. First looking at the progress and goals that the clinicians or the other employees may be focusing on within a quarter, within a month, within a year. Where are their goals, looking at their metrics? Are they having a problem with, or having, not a problem, but having any difficulties converting their patients into better hearing? Do they have any issues having good conversations with patients over the phone when we're trying to get them in for an appointment? We also want to look at roadblocks, any challenges that they may be facing. We have a thing that we talk about start, stop, keeps. What's something that we could start doing that could make your work life better? What's something that we could consider stopping doing? And then also, what's a stuck of yours? Is there something that we could work on to develop and make the process better for you? We also want to use these check-ins productively to foster that development within the clinician. So what do you want to work on in the next month? What do you want to work on this quarter? And how can I help you in that? That's going to help get that professional development rolling, as well as allow us to find ways where we might be able to help train, coach, and foster better performance within the employee themselves. And then, like I was saying earlier, that we care about the people that we're working with, checking in on their overall well-being too. We're going to talk a lot about things that are focused on the jobs that they're performing, but I also want to know how you are doing in your personal life. What kind of challenges has life dealt you? What kind of triumphs are you excited about? I always try to find something to connect with the employee on that's not always work focused, because I want to make sure that they have that sense of care, because they don't know that you care until you show them that you care.
Yeah, that's great. When you were talking about start, stop, keeps, that reminded me, have you had any thing that you've implemented that you can think of on your team that has come out of the Start, Stop, Keep conversations? Um,
Yeah.
and I have an example if you can't think of anything off the top of your head too. So,
I have a feeling that we both are thinking of the same example.
okay.
But in one example of those start, stop, keep conversations that we've had is our employees, being a small company, we try to make the best benefit package that we possibly can to our employees. And we had gotten feedback across a year or so from multiple employees saying the same things about, we'd like better benefits. Could we get dental? Could we get vision? What do you think about maternity leave? In those situations, we don't grant it immediately. We're just actively listening to them, and we're letting them know that we're receiving what they're saying to us. And then we go as a group of leaders or support team and we talk about, okay, well, this is what kind of feedback we're receiving from the team. We're hearing it from many people. Is this something that we could work on and develop to, meet the needs of our employees? And sometimes it's not doable at that time. But we did make some changes at the end of this year, and we've shared it with our employees, and they're really excited that we've been able to expand on our benefits package. And also some of the feedback that I received from them, because I went around and talked to some of them and I said, what do you think about some of the changes that we're making to the benefits? And the feedback that I received is, we're really glad that we've made these changes. We're excited that we have a more comprehensive benefit package. And also, thank you for listening to us. Thank you for finding ways to implement and make it work. So I think that was probably your example, Megan.
Yeah. Thank you for sharing more about
Yeah.
that. I think that's helpful. And so we'll just move on to the next one. How can managers create a safe and open environment to encourage your employees to be able to share openly with you?
Mm-hmm. This is really important. I think that the biggest part of it is being genuine. You have to be genuine with the employee that you're working with. You have to come to them with a smile. You have to put your pride and all of the things that, you can look at somebody and you can find their flaws, but you also need to be able to find their strengths too. So being able to come to them with a smile, being genuine, like I said, if they don't know that you care, or sorry, if they don't care what you know until you know, or until they know that you care. So we want to listen more than we talk. The rule is listen 90% of the time, and 10% of the time give your feedback. And then when you are engaging with them and receiving any critique or feedback from them, asking them follow-up open-ended questions, asking them to tell you more. Tell me more about why you feel this way, or why you feel this could be better if we were to implement this. So tell me more. And then also, I think that also creating a safe and open environment. Take your employees outside of the workplace. Sit them down for a meal. Tell them that you aren't in a rush, that you're not going to, that you're going to spend as much time as you possibly can with them, and make sure that any questions that they have or any topics that need to be discussed are thoroughly covered. So just taking them outside of their own environment that they're used to, where they're not around other employees in fear of them hearing something that they might want to say. And it's just it's a common ground of openness and allowing them to not have any roadblocks to conversation.
Great. What would you say are some common mistakes that managers make when conducting employee check-ins? And do you have any tips on how to avoid those mistakes?
Yes. So one thing that can commonly be done is not being prepared appropriately. Do you know what you're going to go in and talk to the employees about? If you have no idea what you're going to go in and talk to them about, then it's just free for all. And sometimes things are not as organized or concise and clear to the employee as they possibly can be. So making sure that we have that preparedness in it. Also, you have to be very precautious when you're doing these check-ins, not to turn it into something that is a performance review. Remember, we're just talking to them. We're just listening to what they're saying. We're not here to critique and talk to them about a bunch of different numbers when we go into these check-ins. That's meant for the performance review, that annual review where we look over their metrics and how they did for the previous year. So you have to be really careful not to mesh those two together. Keep them separate, keep it more casual, keep it open. Another thing that sometimes can be of lack, you can do check-ins and you can do them often, but if you're checking in and you're setting action items or goals with your employees, and then you're not following up with them, making sure that we are checking in and seeing, are you actually working on progressing and improving yourself? We talk about often a 1% improvement. If somebody can over time improve by 1% and one more percent every year, they're going to be an overall better employee as we continue to grow and develop them in their career with us. So what can we do to continue striving to make little improvements within the company and following up with them on that? So that's keeping that consistency of it. Being prepared is going to be important. It's going to conduct those successful reviews.
Mm-hmm. Have you had a situation where an employee was resistant to participating in a check-in, and how would you handle that?
Yeah, that is such a good question because I did recently perform a review where there was some hesitations from the employee. It was a newer employee. They weren't used to that rhythm of checking in with their support team. And they also had experience being on the management side of things in the past. And from that person's experience, when the manager comes in, usually it's for not so great of a reason. Now, that's not how we roll. We come in and we talk, and even when things are going amazingly well, we still want to check in. So it's just
Mm-hmm.
expressing to that employee that, we're here to listen to you. We're here to find ways to develop and foster your improvement within the company. I think about, again, everybody has different experiences. Maybe they've had an experience being in a manager role or with a manager that maybe was overbearing, was a micromanaging type of individual, that just came in and wanted to critique whenever they've seen them. So, there's that side of things. And then, also just what people have had happen in their personal lives too. Sometimes we've had encounters with individuals in our lives that have beat us down a little bit and made us feel a certain way when somebody comes in to give constructive criticism. So you just have to, with those individuals, tread lightly, tread slowly, make sure
Mm-hmm.
that they know that you're really just there to listen and find ways for them to continue to be better.
Mm-hmm.
Um, so that's really important when it comes to those ones that might be um, hesitant. It's also important when you're doing these check-ins to remind these employees that might be a little bit more hesitant that I want you to know that we're going to be doing these check-ins. This is a rhythm. This is how we behave. This is normal for us to do this. Me coming to you to have these conversations is not always or may never be to try to critique you to make you feel like you're not doing the job that you are meant to be doing. So.
Mm-hmm. Yeah, great. So since you're just coming off of conducting these check-ins, can you tell me about some feedback that you received from teammates after implementing check-ins, and maybe like how did you feel as the manager going into this kind of in that first round of doing these employee check-ins with the team members?
So like Megan just said, I just did my first round of check-ins. I had done check-ins before as a group of leaders, but I did my own individual one-on-one check-ins in the last couple of months with our employees. The feedback that I'm receiving from the teammates has been wonderful. I haven't had anybody tell me that they didn't think that there was value to the check-in. They're very grateful for the opportunity to talk openly with somebody, to share how they're feeling, to share their experiences that they've been having. So the gratitude is there. I got several text messages from the employees that I checked in saying, thank you so much. You spent quite a bit of time with me, and I know that you're busy and I'm busy, but I'm so glad that we were able to step aside and meet up with each other and just chat. Um, they'll also they've given feedback that's previous employers are not doing check-ins like this,
Mm-hmm.
that they don't take the time to sit down with them. They don't offer that level of engagement that we're looking for, to keep an open line of communication with the employees. It has created a better culture for them too. They feel like they can communicate better within the clinic that they're working in, that they have a confidant that they can go to, their manager, leader, support, whatever you want to call them. So they have somebody that they can come to, that they're confident in sharing that feedback. So, even having many check-ins in between the ones where we sit down and we have those more in-depth conversations, uh, and they sometimes they're the ones that initiate it because they know that you are there to listen and that you are there to help them and make whatever situation they may be encountering better if possible. So that feeling of being heard, somebody that will listen to them, somebody that's fostering a culture that they want to live within. And one of our employees actually, she was expressing to me, I love this team so much because of the support that we get, the tools that you guys provide to us. It makes them want to stay more long term, gives us better employee retention, or at least that's what we aim for, is better employee
Mm-hmm.
retention long term, because we are actively listening and engaging on a regular basis with these individuals.
Mm-hmm. Great. So, kind of going into that, what would you say is the line between having that candid conversation and active listening, and then, oppressing a response or kind of gathering a no response from the conversation that you're having?
hmm So again, that openness when you're having conversations with them, the 90-10 rule, listen 90% of the time, talk 10% of the time to them. Um, we have a concept called receive, relax, rescue, that we often speak of within our organization. If somebody is talking to us about maybe a conflict that they're encountering, the receive part, we're going to receive what they have to say. We're listening actively. We're going to then address the conflict at hand, and relax the situation, that we have at hand, and then we're going to rescue or take action on that item. So letting them know that we're here to listen, we're here to find ways and solutions, and that we are going to take that action. So uh, leading with empathy, is
Mhm.
important. Putting your own ego aside is important. In these check-ins, it is not about you. It is about the person that is in front of you. I think that's really important because as leaders, sometimes we have all these different topics or ways that we want to improve, and we want to throw a bunch of things at them, but it's just not the time and place to do so. So there's that. And then also continuing to have those open-ended questions. So questions like, what is working well for you? How can I better support you? And then also asking them if it's okay for you to share with them what you are seeing within the work that they are doing and within the clinic that they're serving. So, really just making, I think, it more about them than it is about you. You have
Mhm.
your own agenda coming into it, but you also have to be able to listen really, really well, and also be willing to hold back from saying certain things. Um, uh, and eventually, if there is a topic that needs to be addressed, you'll find a way to get around to that. But really, just listen. That's going to be the biggest part of it.
Mhm. Yeah, good points. Can check-ins happen too often? What do you think is the right cadence for employee check-ins?
Yes. And I've had a little bit of experience with that. So, for example, you have an employee, maybe they're not performing as well. So you feel the need as a leader to step in and be present, and you're there too much though. So I had an employee that we were having some issues with performance, and for about 2 months, I showed up there once a week, every week. And I reflect back on that, and I think that it might have been a little overbearing for her. It may have put a little bit too much pressure on her. Um, so being overly present can sometimes psych out your clinician or your PCC and make them think that, they're lesser than or not doing the job as well as they really want to. And I don't want to
Mhm.
do that to any employee. I want them to know that, I care and that I'm just here to foster your growth. So you can definitely check in too frequently. As far as a good cadence, my rule of thumb is that on a monthly basis, I want to check in with each clinic that I am overseeing. So making a presence to them, and talking over some of those topics that we may have had a more in-depth check-in where we sat down and had lunch or coffee. Those are little brief check-ins. How are you doing? How can I help? Again, what do I see? And then for the more in-depth check-ins that we do, I would recommend not doing them more than on a quarterly basis where you sit down with them for a longer period of time. But I really think that even twice a year, doing those sit downs is probably sufficient as well. But being very precautious not to be overly present or watchful of the clinician so that you don't, make them feel like they're not, doing their job well.
Mhm. Great. So if a manager is new at employee check-ins or maybe they haven't done them before, what would you say are the first steps they should take, or what advice would you give a new manager?
Yeah. So because I just went through this, first kind of thing I want to say is that the first couple that I did were kind of clunky. And
Mhm.
I've known most of these employees for a really long time. So, I don't think that they necessarily felt like it was clunky. I was just kind of doing introspection of myself and how I went through each check in. But as I went through each one and did more and more and more of those check ins, it seemed more smooth. I felt like I was able to pull out and engage better questions and conversations as I felt more and more comfortable with it. So that is a big part of it is, really you got to jump in, you got to get your feet wet in it. And sometimes at first it's going to seem a little awkward and weird, especially when you're talking to them about things that you don't normally talk to them about. I also would say, as far as that kind of preparedness, like I stated earlier, everybody is different. Everybody has a different life story. And every check-in is structured similarly. However, the topics that you're going to discuss with them are going to be very individualized. So making sure that when you are preparing for each check-in with each employee, that you are sitting down and critically thinking about something that's unique to them specifically, a topic that you want to talk to them about, and have some backup questions for that topic with them. So really trying to make it individualized is important as you're doing that as well. You'll see that, some topics will be synonymous amongst different employees, but everybody has something different that they're dealing with or that they're working on to progress on. So definitely making sure that you make it individualized to them. 3 questions always to go into with. I know I stated it earlier, is how are you doing? That's more of a personal level question. How are you doing? How are you doing in your clinic? And what are you actively working on currently? The second question would be, where do you need support from me? What can I do for you in order to foster a healthier clinic? And then also, do you mind if I share what I'm seeing on a day-to-day within your clinic and its performance? And when I say that, I actually am asking them, do you mind if I share? Because there might be points where they'll say, no, I really don't want to hear what you have to say. And that doesn't mean that we don't talk about it and go through whatever that topic is. That just might not be the time to do it. So knowing your boundaries and when you should just let it lie and readdress in the future, I think is really important.
Mm-hmm. Mm-hmm. Great. Well, thank you for so much great advice, Cassie. That wraps up our question portion of this topic. We do have some more time though, so if anyone has questions, please feel free to type them in the chat and we'll get to some of your questions.
Hey, Megan, Sarah here. Do you want me to read the questions to you guys, or can you guys see them in the chat?
We can see them. So I guess I'll go ahead. It looks like Aranza has a question here. She says, what should the follow-up to the check-in look like, and how long after should the follow-up take place?
As far as what should that check-in look like, so if there's specific topics that you go through with the employees, making sure within a month or so, maybe if it's really important, you might have to follow up more quickly than that. I think it all just depends on what the topic is. But that follow-up, it's, we talked about this at your check-in. We talked about some ways to improve that. How have things been going? Have you been able to implement some of those things that we discussed? And again, is there anything that I can do to support and help that this process get better for you? And then the second part was, how long after should the follow-up take place? Oh, I kind of answered that already. I think it all is just dependent on the urgency of whatever item you're working on. But if you're going to follow up with it, I do say within a month's period of time, definitely assuring that not too much time has gone by.
We do have several, touch points as far as communication with our employees too. So we have quarterly business reviews. We have an annual performance review. Our topic today was employee check-ins, that Cassie mentioned, at least twice a year with a longer sit down, but she's getting in the clinic with her clinicians, monthly. So the cadence would be the next time that she's in the clinic, she would follow up unless of course it's urgent, like she mentioned. So thank you for that question. Hopefully we answered that, Aranza. Mark has one here. When visiting a clinic with multiple team members, do you check in with just one of them on that day or all of them?
Yeah, that's a great question. We have a few clinics that have multiple clinicians or team members within them. I really try not to put too much pressure on myself to check in with every single person as I'm visiting. It all just depends on how frequently you can visit that clinic as well. If you're a bigger organization and you're only going to be able to visit that clinic that has 6 or 7 or however many employees within that month's period of time, and there's no other time for you to check in with them and be present, then you might have to organize and check in with them all within the same day that you're there. Otherwise, for me, I do try to keep it as individualized as possible whenever I can, focusing on one person at a time, and not necessarily giving me a list of I got to do this person. When it comes to those clinics that have multiple team members, I do think that can vary, but it also is dependent on the time that you have in a manager role too, to do those check-ins.
Yeah, we have a counterpart to Cassie, Jeff, who's in a admin leadership role, and he's been checking in with the front office patient care coordinator staff as well. So Cassie, of course, can have those kinds of check-ins and conversations cross-functionally within the different admin and clinician team, but we do have another dedicated support staff member that is checking in with those individuals in the clinic. Rhonda has a question here. When we check in, what is the best way to bring up performance issues while still trying to keep it positive?
That's tricky because again, it's kind of a dance with whoever you're working with. You want to make sure that you navigate it appropriately, that you navigate it with kindness, and show that you want to encourage them to be better at what they're doing. I would say that when it comes to any kind of performance issues, keeping some of that stuff towards the latter part of the check-in, where you're asking them, is it okay if I share what I'm seeing? And or asking them, where are areas that you really feel like you could be growing, whether it's metric related or a process that they're doing while they're conducting an appointment with a patient. So making sure that you have their openness to receiving your feedback, because if they know that they can, if they know that you're open with them and that they can be open with you, they're going to be more willing to receive what you have to say. So I think that's really important, to be precautious. And if you're going to talk about performance, don't make it too heavy on the performance aspect. And that's, what do I see? What would I like to see improvement in on you in the months and quarter and the year to come? It's more of a touch point versus going too in depth with it. In my opinion, you want to touch on it, and then we can follow up more on performance stuff when it comes to the annual performance review.
So Sarah has a question here. Megan or Cassie, could you give a specific example of a difficult conversation you had with an employee and how you handled it?
I have an example. Do you, Megan?
I gotta think for a moment on that one. I'll let you go if you're ready.
That's okay. I'll kind of go back to the employee that I was talking about when we were talking about those, reluctant employees for check-ins. An example of that reluctant employee is because she had been in a manager role before, and when people came in, it was usually to critique and because performance wasn't good. She actually came to me and said, I feel like this check-in is because you're going to fire me. I'm like, no, I'm not firing you. I want to sit down with you. I want to talk with you. I think that you're doing a great job. I am so happy to see the improvements that you're making, the work that you're doing to serve your patients. This is just for us to sit down and talk. We're just having conversations. And I want to talk with you about, where you'd like to see your clinic. Where do you want to see yourself in your performance? So just letting them know I'm just here to listen. I want to hear what you have to say. I also find a lot of value of just sitting down and having an open discussion and not rushing things or putting a time limit on something. So that's why we've decided to sit out of the clinic somewhere else and conduct this check-in because I want you to feel open and to talking to me. So, but yeah, those difficult conversations, it's really, you got to continue to show them how much you care about them. We have to have a lot of compassion and patience with employees.
Yeah, that's good. That's a good example. Um, I guess as far as what comes to mind is when Cassie gave that example of the start, stop, keep feedback. Um, in terms of, improving benefit offerings, I've had some challenging conversations with employees about benefits at times when, employees are asking for something and you want to be able to give it to them. And it's like you're hearing them, whether that's, for example, maybe it's more PTO days or we we talked a little bit about the short-term disability or maternity leave and so it's trying to to listen, be empathetic, show that you care, and then give them an answer, like not just let it go on, but what can we do? And is there a compromise? And then being able to explain the why. Like if it's truly not feasible to be able to provide what they're asking for, trying to frame it up so they understand and can see the bigger picture and not just think, well, they're just saying no, or they're not even saying anything, they're just not answering me. So a lot of my more challenging conversations are usually around like the HR topics, whether that's the payroll or the benefits. So that's what comes to mind. Aranza has a question here. How do you keep the clinic stats and numbers out of the conversation?
For me, I think that it is a choice not to talk too much about the statistics. Again, this is meant to be more casual. Um, uh, we don't want to get into anything extremely analytic when it comes to those statistics. So, I think that if you can keep it more casual and you can, see how the employees are actually doing, how they're feeling in that moment, it's going to be really important. Um, so, I mean, there might be situations where they bring up something specifically and you might go look at some statistics because they're asking about it, but I wouldn't bring up those stats, those metrics unless it was a topic that had come up within conversation. Um, and knowing those boundaries of saying, hey, internal boundaries, I should say, of, I could go into detail of all these different metrics and statistics, but is this really the time and place to do that? Um, you have to kind of read the room and know if that's really the right opportunity to bring that conversation up.
Mm-hmm. Yeah, I think it's building that muscle of like, what is the purpose of the conversation and being really intentional about checking in, and it's the, caring, what is the employee's well-being and how are they doing? And those conversations around metrics, we've got like the biweekly clinician meeting, and we have the monthly all staff meeting, and we've got so many chances, the quarterly business reviews. There's just so many chances to talk about the numbers that this conversation is meant to be, just more personal and seeing how they're doing. Where do they want to go? What goals do they have? Is there development opportunities? So it's a really intentional choice and a conversation, and it does take time and practice, because if they're not used to you checking in that manner, it's like it could be awkward or challenging at first, but once they, like Cassie said, once they can see that you care and that it is a safe space to open up, we've seen that employees really like this kind of conversation and appreciate it.
Yeah, Megan makes a great point. We do, at least in our organization, we are analyzing our statistics, metrics, whatever you'd like to call them, on a biweekly basis. So our clinicians are well versed in where or should be well versed in where their statistics lie. So if you're not talking about it frequently, then it may be something that you feel like you need to have more of a conversation about. But if you have them engaged and they know where they stand, it may not necessarily have to be a topic of those check-ins. And I would encourage to try to stray away from it too.
These are really great questions. Thank you. Any more? Feel free to pop them in the chat. Otherwise, we'll wrap up here in a couple minutes. Okay, thank you, Aranza. She just said thank you. This was a helpful webinar. Rhonda appreciates the feedback. So thank you all. I really appreciate your attention today. We, care a lot about this topic, and it was a privilege to be able to share this with you. So thank you for your attendance, and we hope that you all have a wonderful holiday season with your families and those that you love.
Yes, thank you so much for letting me talk today. I appreciated it and enjoyed all the wonderful questions that you guys had.
Thank you.